Hi there. You are here because you would like to gain some information about a condition called sciatica, which is usually as a result of a disc prolapse or herniated disc in the lumbar spine. I'm going to make a few short videos about sciatica, its symptoms, and the treatment options. Before I start with the main video, I would like to introduce myself. My name is Dr. Bahram Fakouri, or in the UK, Mr. Bahram Fakouri. I am a practicing consultant neurosurgeon, spinal surgeon. I'm based in London and my main hospitals are Guy's and St. Thomas's. In order to make this video more visual and easier to understand, I'm going to present the first part of this talk on my laptop, and it is about the anatomy of the spine and the makeup of the disc. Just bear with me, I'll see you shortly. Now we are going to the next section, which is introduction. If you look here, you see spinal column, 33 individual bones, which are called vertebrae. They interlock with each other and they form the spinal column. And the spinal column connects the head to pelvis. It has got various areas or various sections. The top section is called cervical spine. The middle part is thoracic spine. Here, the green part underneath thoracic spine is lumbar spine, which is connected to sacrum, and sacrum is connected to coccyx or tailbone. In newborn, we have 33 vertebrae, but then later on, the 5 vertebrae in the sacrum, they fuse together and they form sacrum, you can see here, and the 4 vertebrae in the coccyx or tailbone fuse together and they form coccyx. So in adults, or even as a child, later on, we have 26 vertebrae. Between 2 vertebrae, we have the intervertebral discs here, which is green, or simply the disc, and from the top to the bottom we have about 20, actually we have 23 intervertebral discs, because there is no disc between the first and the second vertebra. So as a result of that, we have got 23 intervertebral discs. What is the function of spinal column? The first thing is it protects the spinal cord and the nerves. The second thing is it carries the body's weight. And the third thing is, because of the disc, it enables movement, such as bending forward, rotational movement, and bending to the side. These are the main function of the spinal column. Now here, again, you see the lumbar spine in lumbar vertebra, which is here lumbar vertebra 1, 2, 3, 4, 5, and here, here is sacrum. Then this is a cross section from the area here. So this is one vertebra. You look from the top or from the bottom, and then here, this is the back side of the vertebra. You can see here the arch of the vertebra, and then here you see the vertebral body, and then you can see in the middle the spinal canal where the spinal cord is. On both sides here, this yellow structure, on both sides the nerve roots exit, one nerve root on each side. And then if you look at this image above, you see the muscles attached to the spine or to the spinal column, and you also see the vascular structures in the front. We say the spine contains over 200 ligaments, over 100 muscles, and we have got over 100 joints in spine, and they enable movement with intervertebral discs together. So the image here, it is a cut from the intervertebral disc, and if you look here, you will see the disc has got a tough outer ring, which is called annulus fibrosis, and a jelly core in the middle, which is called nucleus. The nucleus is filled with water. 80% of the weight of nucleus is water, and it is the part which enables movement. And the disc is called shock absorber. I'm sure you heard that elsewhere. This is the part which takes the shock to the body, shock to the body. So the next image here, it shows the pelvis, and this is the nerve which is called sciatic nerve. So multiple nerve roots from the lumbar spine, especially the nerve root L5 and the first sacral nerve root and second and third, they come together and they form the sciatic nerve. And you can see here on this image, the sciatic nerve comes out here in the pelvis, in the back of the leg, back of the thigh and calf, goes down to the foot. And it innervates all the muscles in the back of the leg. This is an image of the spine. This is an X-ray. So usually if you have got back pain or pain in the leg and you see your general physician or your physiotherapist, they may order an X-ray for you. And the X-ray will show if there is any fracture there. It will also show indirectly if there is any problem in the disc space. Here, on this image here, you cannot see the disc, but the disc is here. This is where the disc is usually located. So you can see the shape of vertebra. This is an image from the side, and this is an image from front or from the back. And you can see again here, this is the disc space. This is where the disc is located, and this is where the disc is, and this is where the disc is. This is the pelvis. Now, the next thing is an MRI scan. If you see a spine specialist, the first thing they will order for you is an MRI scan. An MRI scan is something that sheds light on the back and leg problem. So it utilizes a magnetic field, and it is not a radiation. It is not harmful as X-ray or CT scan. So what you see on MRI scan here, so this is a vertebra. In between you can see these are the discs which are plump and which look normal. And here you can see the spinal canal. And then we go backwards. Here you can see the skin and the tissue under the skin, which is usually fat tissue. And then here, if you look at the image on the right-hand side, you can see the disc here is numbered. This is between L1 and L2, L2, 3. And again, here the canal, and you can see here the fluid in the spinal canal. And you can see here the nerve, or here the spinal cord, and the nerves here which go down towards the sacrum. Again, this is the same. So this is a comparison between X-ray and MRI scan. You can see this is the vertebra. You can see here. You can see the disc here clearly, but you cannot see the disc here, but you can guess it is where the disc is. And the canal, and here, this is the spinous process, and you can see the spinous process here. I just put it here for comparison. If you want to look at that, go back later and look at them again. Now, the sciatic nerve. So I already mentioned before that the sciatic nerve comes from the nerve root in the lumbar spine and in sacrum. And the main nerves are L4, actually less L4, L5, S1, S2, and S3, and they go down together and they form the sciatic nerve. And here on the right-hand side, I would like to talk a bit about the disc. The disc connects two vertebrae, or is between two vertebrae. As I said, it has got a tough outer ring here, and a jelly core in the middle. And if there are some cracks in the ring, the jelly core can escape out, and it can cause compression on the nerve root. And you can see on this image here, illustrated, it can cause compression on the nerve root. And then as a result of that, if this is one of the nerve roots which forms the sciatic nerve, the patient experience pain along the sciatic nerve, which is back of buttock and also back of the leg. Again, this is another picture. So you see here clearly that this is here. Again, this is a disc herniation. Here, this is the 5th vertebra, this is 4th, and the disc herniation impinges the nerve root here. You can see the cross section so that the nucleus or the jellicle escaped out due to cracks here in the ring. Actually, not completed. This outer layer of the ring is still intact, but nonetheless, it impinges the nerve root. You can see here that's a picture of that, and that can cause compression on the nerve root, and subsequently the patient may experience sciatica. Here I've got some images from patients who had sciatica. If you look at this image here, this is the MRI scan. This is a picture from the side. You can see here the disc is all right, and it respects the boundary to the canal, and you can see here the disc is completely normal. This is the white structure in the middle, and then here it also respects the boundary to the spinal canal, but here you can see the herniation, which is going into the canal. And if you get a cross section here from this level, you will see this is the bit that went into the canal on the right hand side and touches the nerve root here. And this is again another picture a few millimeters above that level, and you can see here also the same disc herniation, as I said, a few millimeters above, which is on the right hand side and impinging the nerve root. This is another MRI scan. Here is the level L45, not the last disc, this one here, and you can see this is quite big and it goes into the canal. All these things here, you can see this is the herniated disc, which occupies about probably 80–90% of the canal and subsequently impinging the nerve root. One more, this is another patient. So you can see here, the disc here is all right, here kind of all right, but here the disc, again, herniated or prolapsed, it goes into the canal and it impinges the neural structures here or the nerves here. And this is another patient. You can see that the disc here is ruptured or herniated, and it goes into the canal and it is going upwards. It travels upwards. It is quite big, and it may also touch the nerve root here. So this patient may have symptoms as a result of impingement on two adjacent nerve roots. So the pain could be quite significant, or the symptoms could be quite significant. This is another patient, again, a disc herniation at the level 4-5. And then this is another patient. So you can see a disc herniation, and this one travels downwards, opposite to the other one, which traveled upwards. You can see there are various forms of disc herniations. So most levels are 4-5 and 5S1. Now I'm going to the next section and talking about the symptoms. I think I'm going to do that in a different video, as it has become too long. So I will see you in part 2 of the lumbar disc herniation.